Hello, everyone. My name is Fawaz, and I'm a second year nursing student.
And my name is Faris, and I'm also a second year nursing student.
And this is Between Classes with the Faculty of Health Sciences.
All right, so we have a set of questions that we're going to be asking each other. So, would you like me to begin?
Yeah.
All right, let's do it. Let's do it. All right, so the first question is, can you describe what a typical day looks like in your program?
I think nursing is really unique in that every day is different, right? So some days you may have your labs and simulations, which give you that practical aspect of nursing, but then other days you may have your theoretical classes, which give you those theoretical foundations to build your practice on. It's really, really nice. If you had to pick three words to describe your program, what would they be?
I would probably say number one is dynamic, rewarding, and practical. So dynamic in terms of the fact that, as you said, we have lectures, labs, and placements. So there's always something new that's going on. Rewarding in terms of, obviously, as a nursing student, you're also a healthcare worker. And throughout my placements, I've had many moments where I was like, wow, like I can actually use my education to help others and make a difference. And practical, it's not just a textbook heavy program. There is a lot of textbook work, obviously, but you also have many placements. I believe we graduate with like over 600 or 700 hours of placement. So those would probably be my top three. What's something that you learned from working alongside practicing nurses during your placement?
That is a great question. I think the scope of practice of a nurse. I think a lot of the times when people think of nurses, you think of bedside nurses and caring for people at the bedside, which is an important aspect of nursing. But nurses also do things in administration, in teaching, in wound care. There's so many things that go into nursing as a registered nurse, and I was so fortunate to see that a variety of things that you could do as a nurse during my placement. So yeah. Next question is, this is a juicy one. What is your future career aspiration?
I really enjoy learning about the heart and kind of like how lifestyle modifications and how certain things can really impact your heart. So I'd love to explore something within cardiology, but more specifically, I'd also like to get a master's degree and become a nurse practitioner, where my scope of practice is a little bit broader. And I believe that I can exert a greater impact on my patients in doing so. What's one skill that you learned during simulations that you never expected to master?
From first year, we've learned how to take vital signs. So vital signs are just like the different, I guess, measurements. So you can take like your blood pressure, your temperature. You can take the heart rate, the respiratory rate. So we've learned that from first year, but I don't think I truly mastered the art of taking a manual blood pressure until this semester. It really put me in situations where I had to take the manual blood pressure, and just naturally I got better at it.
Glad to hear. I struggle with that too. So I'm glad you mentioned that.
Tell me an interesting fact you learned in one of your courses.
So nursing students take pharmacology, which is basically the course that teaches us about medications, how your body reacts to medications, and how the drugs act on your body. So one thing that I learned that was really cool is that eating certain things or drinking certain things can actually activate or inactivate certain drugs. So drinking grape juice while also taking certain medications can actually lead to drug toxicity. That's actually something that healthcare workers say to their patients in practice, to not take grape juice, for example, with that certain drugs. So that's probably something that was really cool.
I'm craving grape juice right now.
Grape juice, I
Yeah.
feel that. After all this exam season, oh yeah. What's the most challenging part of the nursing simulations?
I think the most challenging part of the nursing simulation is it's also it's a complement of the nursing simulations, is that they are really dynamic. So in our lab, you learn the technical aspects of nursing, right? Like how to do the things. In our theory, we learn like why we do it. But in simulations, we're given like a specific situation or a specific scenario, and we have to use what we learned as well as like our own developing clinical judgment to care for the client. So, for example, you may have a simulation where you have to care for a client who is rapidly changing, right? So maybe you didn't like go through that exact scenario in lab, but you use what you learned in theory and you mix it with what you learned in lab, and then you implement that in simulation. It's really, really rewarding when you when you find out what's maybe affecting the client and helping them navigate through that. What's one skill you've learned on placement that you couldn't get in class?
Clinical judgment. Okay. So throughout the past couple of years, instructors are always stressing clinical judgment. And that's truthfully because no matter how many things you learn in theory, no matter the amount of interventions you learn, the amount of memorization you do, and the amount of practical experience you have in lab and simulation, every patient presents differently. And there's no one size fits all in terms of interventions. When you go out in real practice and you're exposed to individuals with a variety of diseases and walks of life, you really begin to practice and exercise your clinical judgment. And clinical judgment is not something that you just learn. You can't really, you're not taught clinical judgment. It's, I think, a product of experience and also stepping out of your comfort zone. And I continue to progress in that.
Yeah, definitely agree with that.
What's one thing that you wish you knew before first year?
How aggressive the geese are. I think it's good to prepare yourselves. I think it's good to prepare yourselves for the aggressiveness of the geese. No, but one actual thing that I wish I knew was the importance of time management. I feel like time management is probably the most important skill you can use in university. The content, you're gonna get through it. The people, you're gonna make your friends, but I feel like time management is like the glue that ties everything together. So yeah, the geese and time management. What has been your most rewarding moment during placement?
I would say my top rewarding experience was being able to provide client education to my residents. So one of the residents that I was working with had some questions about beta blockers, and beta blockers are basically just a class of medications that help bring down your blood pressure. And I found that, combining my knowledge of pharmacology and just other things I learned in the program, I was able to, provide client education in plain language to that patient, beyond just explaining to them what the blood pressure medication does. When a patient knows more about their medication, this allows them to be more involved and ultimately allows them to adhere more to their medication regime. All right, so now we're at the rapid fire.
All right. No ums, no ahs.
All right.
Just answers.
Okay.
All right. First question. What's your must-have item for placement?
I would say my must-have item is a small notebook that you could keep in your pocket to whatever that is, to really, take note of all the patient interactions you have, how they were meaningful, and even just reflecting on patient experiences. That's a must-have for me. All right, next question. What's your favorite clinical skill to perform?
I really like manual blood pressures. They're really cool.
All right, why?
They're manual.
Perfect.
Yeah.
Next question.
Early mornings or late night studying?
Early mornings, by far. I wake up, my mind is sharp.
Yeah.
I get my caffeine in and I can lock in. Any studying past 8 p.m. is not productive for me. All right, Fawaz.
Yes.
Lecture or lab?
I love lab. Lab is really nice.
Same. I could say the same.
Yeah. Midterm season or final season?
Final season for sure. I'll tell you why, right?
Yeah.
During midterm season, you don't have a lot of time to study.
Yeah.
You still have lectures during your midterms. You have other commitments, but during final season, you don't have any like classes ended. And I typically have my exams late into the exam season, so I always have time to study. What about you?
Summer's calling my name. I love final season.
You love
I love final season.
final season. Perfect.
All right. Test or presentation?
That's a really good question. Honestly, for me, probably presentation. I feel like I'm naturally inclined to public speak and present, so I really enjoy presenting.
Tip and a hack if you're doing a presentation or if your class is doing a presentation, always start first.
And set the standard high so everyone is scared.
Or set the standard low so everyone is relaxed. It works out.
Next question. All right, what's your go-to study snack?
My go-to study snack is probably water. I think water really hydrates you. It also allows me to engage in photosynthesis, so it works out really well.
Water.
Yeah. Anyways, okay.
All right.
My final question is solo studying or group studying?
solo studying. Whoever says that they actually study in groups is either lying or lying. It's one of the two, right? I personally can't group study.
Yeah.
We tried to group study before, but we know that's not gonna happen.
Never works.
It's just a YAP session.
Yeah, like Faris is probably like the most distracting person I think on campus, so it just like makes studying really, really difficult.
Says the guy that has water as a snack.
Yeah.
But, well, we'll leave it at that.
Yes, thank you for tuning in. We hope you enjoyed it.
Bye bye.